Hello everybody and welcome back to my channel. I hope that everyone is staying safe and sound in this pandemic, and I hope that everyone is ready to learn something new today. But first, if you like what you see, give me a big thumbs up. It really helps with the YouTube algorithm. Hit that bell notification so you know when my videos come out, generally between 3 and 4. This is a family-friendly channel. And please subscribe. Please help me out by supporting my channel and subscribing. And as a reward, one random subscriber is going to get $20 when I get to 200 subscribers. I'm still sitting at 150 now, so it's only 50 away. So please do that. I would really appreciate it. And I thank all of those who have subscribed already. Okay, so before I get into this video, generally my videos are okay for kids. However, this topic may not be suitable for kids. It's not a bad topic, it's just that this is a men's health problem. This is Men's Health Month. So I thought I would focus on men's health problems. Not women, only men. Okay. So this is 6 natural remedies for an enlarged prostate, or BPH. Now, I have had BPH in the past, and I'm not ashamed to talk about it. And a lot of men have had it, or will have it. As you get older, it's very common. But rather than go to a doctor, there are things you can do to avoid getting it. So this is what we're going to be looking at. Okay, because it can lead to other stuff. BPH is not, not bad, but it can lead to the stuff that's worse. So, okay, so let's just go into it. So we're talking about the prostate growth. The prostate, which only men have, women don't have it, sorry, is a walnut-shaped gland that wraps around the urethra, the tube that urine flows out of. The prostate is part of the male reproductive system. One of its main jobs, along with other organs, is to add fluid to the semen. This is the fluid that carries sperm. Okay. The prostate gland starts out small and has 2 main phases of growth. It doubles in size during the teenage years, then continues to grow again after age 25 through the rest of the man's life. So the older you get, the bigger it gets. An excessively enlarged prostate results in a disease known as benign prostatic hyperplasia, or BPH for short. Eventually, an enlarged prostate can clamp down on the urethra and restrict the flow of urine from the bladder. This leads to problems such as frequent urination. If this sounds like you, check it out. Difficulty in voiding. That means going to the bathroom. Urinary leakage. That means when you're not going to the bathroom, you leak. Or urinary tract infections. Most of the time, women get it more, but men can still get it. Okay. So read about natural remedies that may improve BPH symptoms. Okay. So enlarged prostate treatments. There are several treatment options for an enlarged prostate. You can take alpha blockers such as tazobactam or tamsulosin, which I did when I had the BPH, to help relax the prostate and bladder muscles. So it's a muscle relaxer, basically. Okay. You can also take dutasteride, or Avodart, or finasteride Proscar, a different kind of medication for reducing BPH symptoms. These block the hormones that cause the prostate to grow. Combination of these 2 different types of medications may also be recommended. Your doctor may also recommend surgery to remove the extra prostate tissue. One common surgical procedure for BPH is known as transurethral resection of the prostate. I never heard of it, but okay. There are also natural remedies that may work to combat enlarged prostate symptoms. This is what we're focusing on, the natural stuff. However, the evidence is debatable on whether these treatments actually work. The American Urological Association currently doesn't recommend any herbal therapy for managing BPH. So I'm not, I don't use herbal stuff. If you do want to try any of these natural remedies, talk to your doctor first. Some herbal treatments can interact with prescription medicine. The U.S. Food and Drug Administration, FDA, doesn't regulate the quality or purity of herbal supplements. This means there can be a lack of consistent ingredients. So, before I continue, I just want to let everyone know that I'm not a doctor, nor do I play one on TV. Use this stuff at your own risk, okay? I can only tell you what I have used and what has worked for me, okay? Saw palmetto. I have used saw palmetto before. Saw palmetto is an herbal remedy that comes from the fruit of a type of palm tree. So it comes from a palm tree. It's been used in alternative medicine for centuries to relieve urinary symptoms, including those caused by an enlarged prostate. According to the National Institute of Health, a few small-scale studies have suggested that saw palmetto might be effective for relieving BPH symptoms. However, the NIH, reports that when larger studies were conducted, they didn't find saw palmetto any more effective than placebo. Research continues to look into anti-inflammatory and hormone-blocking properties that saw palmetto may have and its possible use in combination with other medications. Saw palmetto is safe to use, but minor side effects can be upset stomach and headache. Beta-sitosterol. I don't know what that is. This herbal medication is a mixture taken from different plants that contain cholesterol-like substances called cytosterols or phytosterols, plant-based fats. Several studies have suggested that beta-sitosterol can relieve urinary symptoms of BPH, including the strength of urine flow. Some scientists have also suggested that it's these fatty substances like beta-sitosterol, which is also found in palmetto, that actually do the work. So if it's found in palmetto, I would rather take saw palmetto because I know what it is. Okay. There haven't been any major side effects reported with the use of beta-sitosterol. However, doctors still don't know all the long-term effects of this natural therapy. Okay. Phygium comes from the bark of the African plum tree and has been used in traditional medicine to treat urinary problems since ancient times. It is often used to treat BPH symptoms, especially in Europe. Because studies on it haven't been well designed, it is hard to know for sure whether it's effective. According to the Canadian Journal of Urology, some small studies have suggested the supplement can help with bladder emptying and urine flow. However, the studies reviewed were inconsistent. Phygium does appear safe to use, but it can cause upset stomach and headache in some people who take it. There were no studies on long-term safety. Okay. Ryegrass pollen. Ryegrass pollen extract is made from 3 types of grass pollen: rye, timothy, and corn. A review of herbal studies published in BJU International found that in one study, men who were taking ryegrass pollen extract reported improvement in their nighttime symptoms of getting up to urinate, compared to those who were taking a placebo. However, the study lasted only 6 months. It didn't look at how well the supplement worked compared to prescription medications. Okay. Don't know anything about that, I'm just reading it. Stinging nettle, I've heard of this. You'll know if you accidentally touch the common European stinging nettle. The hairs on its leaf can cause a sharp jolt of intense pain. But stinging nettle may have some benefits when used as a medicine. Nettle root is thought to improve some BPH symptoms and is commonly used in Europe. However, a 2007 review concluded that more studies were needed. Currently, there's no strong scientific evidence to suggest that it's more effective than no treatment at all. Sometimes nettle is used in combination with other natural BPH treatments, such as Phygium or saw palmetto. Side effects of nettle are usually mild, including upset stomach and skin rash. So if you take something and it causes more problems than you have, I would stay away from it. But that's just me. Okay, now, so here, foods to treat BPH. The role of diet in the prevention of BPH and in treating its symptoms continues to be explored. A recent 4-year study in China looked at the effects of diet on BPH symptoms. Researchers found that men with diets high in fruits and vegetables, especially leafy dark vegetables and tomatoes, had less BPH, less symptoms of BPH, and were less likely to have worsening of their BPH. Researchers believe it's not just one nutrient, but rather the combination found in a healthful diet and lifestyle that are beneficial. So, that doesn't hurt to eat right. going to natural root. It's important to remember that just because a supplement's labeled natural doesn't always mean it's safe, healthy, or effective. Remember that the FDA doesn't regulate herbal remedies like it does prescription and over-the-counter drugs. That means you can't be totally sure that what's listed on the label is inside the bottle. Herbal remedies can also cause side effects in other medications you take. Check with your doctor before trying another supplement. Okay, so I'm not going to go into over-the-counter medicines because, again, I don't suggest it. Okay, these are just talking about the different, the different stuff that I was talking to you about. So that's not what we need. Okay, so let's get out of this, please. Okay. So, anyway. Okay, so that's basically what I wanted to talk about. So, again, remember, I'm not a doctor, nor do I play one on TV. I find that cranberry juice helps me quite a bit. I've also heard that drinking lots of fluids like water can help you too. And it's not going to hurt you. You know, it's safe to be drinking cranberry juice. It tastes good. I personally do it myself. And, you know, it does help me. I mean, I even drink cranberry ginger ale. Because the ginger ale settles my stomach and the cranberry helps me to urinate. So, I mean, you know, I used to get up multiple times a night. Now, maybe I might get up once a night, but never more than that. So, you know, again, you use this at your own risk, but I think the best way to go is natural. No vitamins, no medication, no nothing, just focus on food. Okay, a healthy diet. I think that'll work with everything and it's not going to hurt you. Again, if you like what you see, give me a big thumbs up. It really helps with the YouTube algorithm. Hit that bell notification so you know my videos come out. And please, please do me a favor and subscribe to my channel. You know, I want to know that people appreciate what I am doing and they want to come back to see what I have to offer. You know, I know a lot of people watch my videos because I have a lot of views and hours, but very few people subscribe. And I don't know if it's because they don't want to subscribe or they don't want to create a YouTube account. But please, if you do have a YouTube account or if you can create one, please do me that favor and subscribe to my channel. And by subscribing, you'll be entered into a drawing to win $20 when I reach 200 subscribers. But you must comment so that I can see you. I thank you. I will see you tomorrow. Stay safe. I will be doing a Filipino food video tomorrow. Not sure yet what I'm doing. It all depends on what my wife cooks. Stay safe. Get yourself vaccinated. And goodbye.